Hi everybody, this is Dr. Hall and we're going to go over the structures of the posterior abdominal wall today. So as we get ready to start, I want to show you, I've started us off with some landmarks, the lumbar spine and the iliac crests. I've also prepared a whole bunch of nerves and some different colors for muscles. So first of all, we're going to talk about the muscles that we're going to find making up the posterior abdominal wall. The first pair of muscles are called the quadratus lumborum. Quadratus because it's a quadrangle, it's kind of a rectangularly shaped muscle, and we're going to find it directly adjacent to the lumbar spine and extending down to the iliac crest. Now you know that fiber direction is really important here. So when we think about the directions in which muscles can pull, right? Muscles only pull, they never push. We need to know the orientation of their fibers. And so the quadratus lumborum, their striations are going to go this way, right? Muscle fibers are going to go this way. So when these muscles contract, right, they can flex the spine laterally from side to side. Lateral to the quadratus lumborum muscles, we're going to see an old friend, the transversus abdominis muscle, which has continued around from the anterior abdominal wall to the posterior abdominal wall. And you will recall that the transversus abdominis muscle has fiber direction running horizontally, right? That's the muscle that when we contract it, it kind of sucks our stomach in, helps to stabilize your core, right? Also helps you go to the bathroom. So fiber direction is this way, horizontal with the transversus abdominis muscle. All right. Let me make sure the video is still recording. Okay. Next, we're going to have the iliacus muscle. So the iliacus muscle is named for the bone on which it sits, the ilium. So the iliacus muscle is a very broad muscle that we're going to find basically covering the entire deep surface of the ilium on each side, right? So this is just my iliac crest, but the entire bone of the ilium is underneath that and deep to that. So let's put in an iliacus muscle on the other side here. Right? And it's going to cover the whole inside of the iliac bone. Fiber direction of the iliacus muscle is a little bit oblique. It's running a bit like this. Okay. Now we're going to talk about actions of this muscle in just a minute because we're going to add another muscle called the psoas major. We have two different psoas major muscles, one on each side. But then we also are going to have a psoas minor muscle. So the psoas major muscle is going to be either side of the lumbar spine and then extending down. And it's big and it's very rounded. This is the tenderloin, actually, if you've ever bought a pork tenderloin. All right. I know it's kind of yucky to think about. All right. And what happens actually is that the psoas major muscle, whose fibers are going vertically, combines with the iliacus muscle to form the iliopsoas muscle. So actually the tendons of these muscles, right? So it's attaching here to the ilium and the lumbar spine. The tendons of these muscles are going to come down and insert on the lesser trochanter of the femur, allowing us to flex the hip, right? So that's a really important muscle. So I did allude that there's another muscle called the psoas minor muscle. Now the psoas minor muscle is not present in everyone, and even if you do have one, sometimes you have one on one side but not the other, which is very strange to think about. Sometimes we are asymmetric even in our own selves. And the psoas minor muscle, if it's present, is characterized by a really broad, shiny white tendon here. The muscle itself is very small, just this more superior aspect. And then the remainder that we see is a broad, shiny tendon. So I'm going to make my psoas minor muscle for the left side here. Okay. So now we have our muscles, and we're going to use our muscles as landmarks for understanding where we're going to find the pairs of the 7 different nerves. So let's start superiorly. The first nerves we're going to run into are the subcostal nerves. And so we can break that word down. Sub means underneath, like submarine. Costal means rib. So right underneath the 12th rib, which is about here, we're going to see a nerve coming out from the spinal cord on each side, and that's going to be your subcostal nerve. Next, moving down, are what I like to call the Ilio Brothers. We have 2 nerves, the iliohypogastric and the ilioinguinal, and they come out from deep and sometimes through the psoas major muscles, and they traverse the quadratus lumborum muscle. So that's a really important landmark for us when we're trying to figure out what nerve is what. So if it's crossing the quadratus lumborum muscle, it is one of the Ilio Brothers. Now, what do I mean the Ilio Brothers? So the iliohypogastric and the ilioinguinal nerves both have a common origin. Sometimes they diverge pretty proximally and sometimes pretty distally. All right, so we'll see something like that and like that. The more superior of the 2 is the iliohypogastric. I remember it because it's alphabetical. H comes before I, so iliohypogastric. And then inferior to that is the ilioinguinal nerve. This nerve is then going to travel around or down toward the inguinal canal. So we have our subcostal nerves, our Ilio Brothers, which are the iliohypogastric and ilioinguinal on each side. Continuing inferiorly, we're going to find another pair of nerves which are going to cross the iliacus muscle. So again, using the muscles as a landmark. If you see a nerve that is crossing the iliacus muscles, this is the lateral femoral cutaneous nerve. I think of it as the LFC, kind of like KFC, but different. So lateral femoral cutaneous nerve. This nerve doesn't do very much. It actually only supplies some somatosensory innervation to a small patch of the lateral thigh. It's a pure sensory nerve. It doesn't have any motor component. It doesn't do very much. All right, so the next nerve we're going to run into is actually quite a big one. And it's going to be coming out and traveling inferiorly. It's going to be right just lateral to your psoas major muscles. This is your femoral nerve. Okay, so this is coming off of your lumbar plexus, which is deep to these structures. We can't see it here. And it's going to go down and supply the anterior compartment of the thigh. Femoral nerve is quite large. Should have made those even bigger. All right, we have a couple more nerves left. On the cadaver, if you retract the psoas major muscle laterally, you will find a nerve coming out here. It's kind of hidden. And that's called the obturator nerve. Let's put one in on the other side. That's the obturator nerve. The obturator nerve supplies the muscles of the medial compartment of the thigh, And so there's the obturator nerves. They're kind of a peekaboo. They're quite deep. You have to really look for them, really retract that psoas major muscle to find them underneath. We only have one pair of nerves left, and those are the genitofemoral nerves, and they're very tiny. And as you can imagine, they're going to supply the genitals and some of the inner thigh. I'm going to make this a little bit smaller here. And the way to remember those nerves is that you're going to find them on the surface of the psoas major muscle. Okay, they're tiny. I should have made them much smaller. Little tiny nerves on the surface of the psoas major muscle. So this is a lot of different nerves and muscles to remember. Let's review the muscles first. Quadratus lumborum, because they're quadrangular or rectangular in shape and attach to the lumbar spine. Fiber direction like this. Transversus abdominis, our old friend, horizontal fiber direction. Iliacus muscle covering the inner surface of the ilium, fiber direction like this. Psoas major muscles coming down to help us flex the hip, and psoas minor muscles. For the nerves, if you leave out the ones with femoral in them, it's alphabetical from superior to inferior. Subcostal is C, Ilio Brothers, iliohypogastric, ilioinguinal. LFC, lateral femoral cutaneous, skip the femorals, and then O for obturator. So it goes C, I, L, O. And then we've got our genitofemoral nerve here and our femoral nerve there. All right, that's it for the posterior abdominal wall. See you next time.